name is Monica Matsumoto. I'm a PGY2 or a first-year radiology resident at the University of Pennsylvania. Our paper here, we describe a case that utilizes a hybrid CT-angiography system to improve the visualization, safety, and efficiency of complex sharp recanalization for a chronic lower extremity venous occlusion. Chronic venous occlusions can have a severely detrimental impact on patients' lives, leading to post-thrombotic syndrome with lower extremity pain, swelling, and skin changes. Recanalization of chronic venous occlusions can be a complex procedure requiring precise techniques and a variety of tools. A hybrid CT angiography system integrates volumetric CT fluoroscopy with fan beam CT, as opposed to C-arm cone beam CT, all in the same room. There is certainly still a lot to learn about venous interventions in general, as most of the field traditionally has been focused on arterial work. But as we know, DVTs are extremely common, so post-thrombotic syndrome is likely a more widespread problem than we realize. But there is a lot of potential in endovascular treatment of this condition. What is so great is that this case simply builds off basic IR techniques and technologies, combining them in unique ways. Two major learning points come to mind. First is the sharp recanalization and flossing technique we described in the paper to bypass the occlusion and form a new lumen. We used a variety of tools, including a Roche Uchida liver set, snares, covered and uncovered stents, and angiojet. We also utilized the gun sight approach initially coined by Dr. Zeev Haskell to precisely control the anastomosis. Second is the utility of a hybrid CT angiography system to improve imaging guidance, ergonomics, and efficiency while performing these difficult procedures. The system was developed in the early 1990s, and as I mentioned before, it allows for CT, conventional fluoroscopy, and angiography to be performed on the same table. As this paper notes, this patient had undergone multiple failed attempts to recanalize the occlusion using standard catheter and wire techniques. So the main message here for patients is threefold. First, patients in the medical community need more awareness about post-thrombotic syndrome, including its presentations and treatment options. Fortunately, at the institution where this was performed, our vascular surgeons were aware of options and made the referral to IR. It is also part of our ongoing work as interventional radiologists to increase awareness. Secondly, IR has terrific tools in its arsenal to help these patients who often have no other options. And we are always striving to find the safest, least invasive way possible. Finally, we are using technology in new and more advanced ways. New imaging technology can allow us to do procedures more safely and more efficiently. We're optimizing devices, repurposing devices, and creating brand new tools, which is always exciting for the future of the field.